So I've been noticing a lot of people have been coming in for health checks, and I love that. Nothing makes me happier than people not getting unwell, not getting chronic disease, keeping fighting fit, and living our healthiest and happiest lives. So when someone comes in for a health check, there's a few general things we talk about. I'm going to talk about a women's health check today, and then next video we'll talk about the men. So the women, I think everybody sort of almost invariably has a health check when their pap smear was due, but these days it's due every 5 years unless we're watching things closer. So unless everything's going really swimmingly well, which is fine, it does pay to come in. It does pay to come in, get your height and weight registered, to make sure that your blood pressure is nice and normal and we're not missing something that's quietly lurking there that can hurt your heart and your brain. Do some blood tests. Look at things like cholesterol, red and white blood cells, liver and kidneys. Things like vitamin D are so important. I'm finding so many people are low, and it's so vital for so many different things, not just keeping our bones nice and strong. Certainly want to check on a thyroid and getting the full history. Your personal history, your family history, to see if there's anything that might be susceptible genetic-wise or hereditary that we just want to keep an eye out on. There can be things like people have someone in their family that's had bowel cancer. Should that person be going to see someone to get a colonoscopy to make sure that we don't miss anything? And if we catch something, we catch it early. Well, it's easy to get out and it's not affecting the life greatly, as in missing a cancer. Mammograms. Now, I like this breast screen service. These people, that's all they do all day, look at breast tissue imaging. So it's just, if anybody's going to look at your mammogram, those are the ones you want. Certainly if you have a symptom, a lump or a bump, get into your GP right away, get it examined, get it biopsied, get it sorted. But for those of us that don't have a problem, just to have a look and make sure that nothing quietly is changing that needs to be addressed ahead of time. And we've got the bus that comes up here, which is brilliant. So you get on, call, make sure that they've got your details, and call you every 2 years. Speaking of every 2 years, the joy of turning 50 brings with you as a birthday present what's called the fecal occult blood test, which is a poo test that we send off to see if there's any signs of blood. Nothing's 100%, you know. If someone has a problem and they didn't bleed on that day, it'll miss it. But for those that have had a bleed and they didn't know there was a problem, it can catch something serious. It can catch something benign. But there's only one way to find out, and that's to go and have a look and find the cause of that bleed. Let's talk nutrition. Let's talk about moving our bodies and being physically active. Let's talk about how well are you sleeping or not sleeping. How are you dealing with stress? What are the relationships are in your life? A health checkup on all these things. Have a look at what is giving you the optimism in your life for the best and healthiest and happiest life. So go, contact your GP, get a health check, get it looked into, keep fighting fit, and ultimately staying out of GP's offices. All right, take care, enjoy the day, and I look forward to talking about men's health tomorrow.